name's Robin. I'm going to be your nurse today. We have orders from the doctor to do a Foley catheter. Can you tell me your name, date, or name and birthday? I'm going to wash hands, put some gloves on so we can get set up. And then we're going to do 2 forms of identification, compare the name that the patient gives me to what is on the wristband. We're going to do patient education on what a Foley catheter is, let them ask any questions they have to ask. And then we're going to double check and make sure we don't have any allergies to shellfish, iodine, or latex. All right, we're going to expose you just a little bit. We'll put that there for trash. Trash as well. I'll take these gloves off now that we're finished touching the patient. We're going to pretend this is a female patient, not a male. This would be for a male patient, so we don't need that. And now this is the point where we hit red. We're going to stop and move over and do our sterile gloves. I'm going to start with the dominant hand. Hitchhike the thumb. And then once you get the gloves on, then you can adjust them to make sure they're all good. After that, you want to keep hands up and not break sterile field. We're going to open these. Iodine. Going to put the lubrication in the corner of the box. I'm going to set this to the side because we're not going to use that unless we need to collect a specimen. All right, and then for documentation, we're going to check the size of the Foley, and this one is a 16, and we're going to document the size, and we're going to document, because I may not be the nurse that takes this catheter out, we're going to document that there's 10 milliliters inside the balloon after we blow it up. Go ahead and have that sitting on there. I'm going to take our tray and move to the bed. Okay. You're going to feel me touch you, so we would separate the labia. We're going to pretend this is a female patient. I'm going to wipe the side farthest away, the side closest, and the middle. You're going to put the Foley in the lubrication, and then you're going to insert the Foley and say, bear down for me. And you're going to push, until you see urine. And with a female, you're going to push 1 to 2 more inches and then pinch so it doesn't come out. Then you're going to push the 10 milliliters in, and then you'll pull to make sure it's positioned properly. And then we will take this and put the stat lock on the leg. Before we do that, we'll take the gloves off, wash hands, put on some clean gloves so we don't get iodine everywhere. Then we'll put the stat lock on the leg, and we'll hang the bag down here on the side of the bed, not on the rail, on the part that's not moving. And we'll document what comes out, what it looks like, the color, consistency, and odor if there's any, and how the patient tolerated the procedure. And then to remove it, while the bag is still down, we'll dump it out into a measurable container, measure how much is in it, and color. And then you'll pull the bag up, remove the stat lock from the leg. You won't have the box sitting here, it'll just kind of be on the bed. And then you'll pull the 10 milliliters of fluid back out. And then you'll tell the patient to take a deep breath and pull it out. And you'll use a napkin underneath to check for blood or pus. And you want to make sure that the Foley is intact, make sure there's no particles left over from the device.